Okay, this video is called What is Brain Span? And I already did mention this briefly in a recent video where I was sort of disagreeing with Doug Lisle. He's the psychologist guy who gave a lecture on Chef AJ saying, oh, you don't really need to follow diet so close. And he's a smart guy, he's funny, he's nice, and he did write a good book, The Pleasure Trap. But I thought he was, telling people to slack off, and the average person has so many bad habits that you tell them to slack off on a couple things they were doing well, and they got potential to deteriorate. And the emphasis has typically been lifespan, how long you live. That's all he talked about, longevity. But, health span, of course, is quite important. How long from birth until you become sick and debilitated. But the unique insight I had was that tons of people are mentally brain damaged, cognitively impaired before people would describe them as being significantly sick and debilitated. And I thought up that word on my own, brain span, but now I've looked it up since then, and the word did exist before me, so I don't get to coin the word. But anyways, be that as it may, what are the warning signs that you're likely to become stupid prematurely, cognitively impaired to the point where you're no longer going to be capable of doing the intellectual things that you want to do? Number one, if you're fat. Being fat's bad. All kinds of bad things happen to fat people. Number two, hypertension. Hypertension is the most common cause of stroke. Okay. Being diabetic. Also, I should say having atrial fibrillation. Hypertension, diabetes, and atrial fibrillation are the three most common causes of stroke. I see them every single day. Coronary artery disease. Because if you got coronary artery disease, that means you got atherosclerosis in other parts of your body. It's a systemic disease. It's always everywhere. That's why the only effective treatments are diet, and then drugs is a second choice. Diet works much, 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 much better, like the Esselstyn diet, the McDougall diet, the Spartan vegan diet, which is my diet, just a low-fat vegan diet with no oil. Okay, poor dentition. I say that because I look at tons and tons of brains on MRI and on CT, and I can tell you the vast majority of cognitively impaired patients, they have poor dentition in their teeth, and they've got cataract surgery on at least one eye. It's routine that they got both eyes, I joke that it reminds me of like what Dice Clay used to say about all he wants in a woman is two TITS. I'm not even going to say it because it's so rude, but I can say as soon as I look at a CT, bilateral cataracts, bad teeth, a dentulous, a bunch of cavities, periapical lucencies, I'm like, patient's cognitively impaired, and that's usually the case. So anyways, if you see yourself drifting into any of this stuff, you want to really get your act together because you're at high risk to end up cognitively impaired. And I see it, when I do procedures on patients, and my internal medicine friends tell me, they routinely see almost all of their patients over 60 are cognitively impaired, very mentally slow. And these are the kind of people who, they can find their way home, but that's about it. You wouldn't want them to do much more than that. You wouldn't trust them to do anything intellectually. So anyways, that's the concept of brain span, and it's pretty important, and it's not often thought about. Most health influencers, they come from sort of a background like internal medicine or family practice or something. They're oblivious to the brain. And the brain's much, much, much more demanding and fussy than is the rest of the body. The highest mitochondrial levels of function are in your eyes, in your retina, and in your brain. Okay? You look at an FDG PET scan, you'll see the brain lights up more than anything. Anyways, I hope you found that helpful.